Hey everybody, this is Dr. Jay Greenstein. I'm here with my good friend Dr. Matthew Mintz. Good to see you again.
Good to see you.
And today we're going to be talking about the importance of alternatives to patients' pain. And we know that there's this big opioid crisis. Everybody's talking about it. It's on the news every single day. But the opioid crisis is also a drug crisis. We know that deaths from muscle relaxers have gone up fivefold since 2002. We know the FDA has placed a warning on NSAIDs regarding their increased risk of heart attack and stroke, even within the first weeks of taking these medications. And there are evidence-based alternatives, and there's some emerging alternatives as well. So before we get started, Dr. Mintz, do me a favor, tell the audience a little bit about yourself and your background.
Sure, thanks, Jake. So my name is Matthew Mintz. I'm an internal medicine physician. I do internal medicine and primary care. I was full-time faculty at George Washington University for about 20 years, where I mixed seeing patients and also was involved in the teaching program. And then about a year and a half ago, decided to start my own practice here in Bethesda. So I have a solo practice, concierge primary care internal medicine practice here located in the Wildwood Medical Center in Bethesda, Maryland, where I see patients for regular primary care needs.
And we met, what, like 15 years ago?
When you used to come to GW and talk about your new clinic,
yes,
which
yes.
grown and expanded wonderfully. So.
Yes, and it was great because we also had a chance to educate the medical students on chiropractic and evidence-based rehab, and that was really, really cool. We always enjoy collaborating with you, and we still do to this day. And your patients absolutely love you, so so it's great to be here today.
Thank you.
So, Matthew, tell us a little bit about some of the emerging things that are happening with managing pain and how you're using things like cannabis to help your patients.
Right. So cannabis is very new to this area. It became legal a while ago in the state of Maryland, but the dispensaries didn't start opening until about a year ago. So medical cannabis has been with us now in the state of Maryland for about a year. I decided to start certifying patients for medical cannabis around that time, mainly because there was a dispensary in my building. I really didn't know much about it, but when I met with the owners before it opened, it really opened my eyes. This is maybe a good alternative for some of the common things that I've treated. And I've been really impressed with the results. I've certified almost 400 patients by now. My youngest patient is 7 years old. Wow. The oldest patient I've certified is 93. So I have a lot of experience with a variety of different patient types. And I found cannabis to be very safe and effective for a number of conditions, and primarily one of the ones that you see is chronic pain.
Sure.
Opioids, everyone knows what Percocet is, and that basically, if you think about it, where does that come from? Well, it comes from the poppy seed plant, where you can get opium and you can make that into opiates. You can certainly make that into drugs and use it recreationally. But marijuana is the same thing. It's a plant that has medicinal properties. It can be used recreationally, but also you can take those same properties of the plant and make them into a medicine that's medically beneficial. And so similar to the opiates, cannabis has a number of effects, one of it being anti-pain. It also can be a muscle relaxant. But unlike the opiates, it doesn't have that addictive property to it. And also, it doesn't act in the same places on the brain. So you really can't overdose on cannabis. You can't. It is non-addictive. You can't overdose. Medical cannabis has never killed anyone. Whereas people are dying day by day, almost 100 or 200 a day from opioid deaths. So it's a much safer alternative to prescription pain medicines, and can be very effective.
And it's so interesting because there's a lot of questions around like CBD and what is CBD and how does that compare to cannabis, and what works well for chronic pain. Is it just CBD alone? Is it CBD with a little bit of THC? So talk to us about the evidence, and then we'll first explain to people what the differences are. And let's talk about the evidence.
All right, so let's talk about the marijuana plant. So the marijuana plant has a number of different, we'll call them phytochemicals, agents that are natural that have medicinal properties. The two main ones that people know about are CBD and THC. THC is the thing in marijuana that makes you high, but also has some very good pain properties. In fact, medical marijuana can be not only it's in the leaf, but you can make it into pills and liquids and even topicals. And some of the topical preparations for medical marijuana are pure THC, but because they're on the skin and they don't get absorbed in the bloodstream, doesn't make you high at all.
Wow.
So THC has some medicinal properties, and then CBD also has some medicinal properties. It's a very good anti-inflammatory, a very good anti-anxiety, can help with some other things as well. And then in addition to the CBD and the THC, you have a bunch of other components that also have medicinal benefit. And so these are called terpenes. Terpenes are what give the plant its sort of flavor and its smell, and can be found in other things like limonene is a very common terpene found in certain strains of cannabis plants. The same things as in lemons. That's what gives lemons the smell. They have some medicinal properties. And plant-based medicine has been around for forever, right? So you have a bunch of different things in the plant that can be used in other ways. You don't have to smoke it. You can use it other ways that have these medicinal properties. Now, in general, it works best when they're all working together. So you have the THC and the CBD. CBD does not make you high, but even the CBD with a teeny bit of THC, based on the literature, seems to work a little bit better. That being said, CBD by itself also can work. And so in addition to the marijuana plant, you have a related plant called hemp. And the difference between hemp and marijuana is that hemp has almost no THC. And because it has almost no THC, it's basically legal everywhere in the United States. So you can get pure CBD just from hemp. You can get pure CBD from marijuana as well. The difference is the legal status. So marijuana is federally illegal, and it's medicinally legal in many states. And so you can get pure CBD from medical marijuana, but you have to get it from a dispensary, which means you have to get certified, you have to register. If you just want CBD, because it's a hemp-based product, you go online and buy it.
Sure.
So
go to Amazon.
You can go to Amazon and get CBD that way. Now the problem with CBD is because it's not very regulated, and there's a lot of people selling it, it's sort of like the Wild West out there. You don't know exactly what's in it, what's not in it, who's the manufacturer, so you have to be very, very careful.
So what should they look for?
You want to make sure that the company is a company that's pretty much dedicated to just CBD products and not trying to sell a lot of other things. You want to know what their processing is. Where does the hemp come from? Is it organic? Is there pesticides? How do they process it? Most reasonable companies will have a couple of different ways that they process it. So the strongest one is sort of pure, unfiltered, sort of the extract tends to not taste as pleasant, so there are different formulations. So there's usually, most legitimate companies have a couple of different formulations. Usually it comes in liquids that you put under your tongue, and also comes in capsules. There's all these companies coming out with like soaps with CBD and drinks with CBD. Whether that stuff works or not is not clear, so I would steer clear from that. But you definitely want a reputable company. You want to know what the processing is. It's very confusing though.
Yeah.
And you want to make sure also, you want to know how much CBD comes in that product. So I had a patient once who, for a number of reasons, could not take medical marijuana based on job status. And I'd recommended CBD, and he went online and he got this hemp product. And so hemp is used for a lot of things. You can make rope out of it, you can make shirts out of it, and he got a hemp-based extract that had no CBD in it.
Wow.
So you have to be really careful when you look online about these things.
That's great. So a patient comes to you and they're in chronic pain and they don't want to go down, the traditional drug route. They want to stay away from the opioids and the other drugs. How do they know whether or not to use a topical, to use a vape, to smoke marijuana, to use an edible? Like, how is that decision made?
It's a very good question. So right now, while there is research on medical marijuana, A, the research is very limited, and B, the research is not good enough to tell you specifically what strain and what dose and what formulation to take. So that's problem one. Problem two is everyone is very individualized. Certain people respond very well to small doses of medical cannabis in certain formulations, and certain people need larger doses. So it's very individualized. So for those reasons, you have to work carefully either with a certifying physician who knows how to direct you, or at the dispensaries. And so right now, most of the experts on sort of what to take and how to take it and how much are at the dispensaries. At least in the state of Maryland, many of them have come from other states like Colorado and California that have been doing it for a while and have some experience. Once the federal status changes and we can do the research that we need, I think we'll have more definitive those answers. But right now, you're sort of relying on some of the folks at the dispensary. Hopefully, and you also, if you want to get certified, you have to be certified by a medical professional. There's a lot of variability there, but you sort of want to see someone who sort of can guide you through that process and tell you how to do that.
That's fantastic. So last question for you. where do you see the future of cannabis going? Do you see insurance coverage happening? You mentioned, federal legislation possibly changing. What's the future?
That's a really good question. So I think the first thing that I definitely see in the near future is the federal status changing. Even if it's not legalized everywhere in the United States, if you right now, so opioids are categorized as a Schedule II. It means they're highly addictive, okay, but they have some medicinal properties. And so if you want to get an opioid like a Percocet, you have to see a physician or other one who has that. Yeah, there's a special status. Not every doctor or nurse practitioner can write for narcotics. You have to. There's a certain qualification for that. Cannabis is above that. It's a Schedule I, which technically means that it's highly addictive and has no medicinal properties. And the truth is, it's the exact opposite. It's less addictive than caffeine and has many medicinal properties. And so there were a lot of politics involved in making that legislative decision. So I believe that will change. That's step one. Once that happens, that's when the research that we need starts to happen. That's when the medical community starts to accept this more. And I think, NIH, which is just literally down the street from where we're sitting now, they can't study this stuff because NIH is part of the federal government and it's federally illegal. So we need that research. We need to know what dose, what formulation, what treatments,
what condition.
What condition. So all of that, and again, we have some research, but just not the wealth of research that we have when it comes to, let's say, prescription medicines for certain diseases, because it's a approval process. So I think that's the second thing that'll happen is you'll see, once the legal status changes, you'll see research being done, you'll see the medical community more willing to prescribe that. I mean, right now I'm one of the few physicians in the area that sort of advertises that I do this as part of my medical practice.
Sure.
My guess is 5 or 10 years from now, every doctor will do this as part of their regular medical practice, and you won't have to see a special doctor like me going out of your way. Your regular doctor will be able to do that. Then the third thing is whether insurance starts covering it, and I think it will. I think there'll be enough pressure, and the reason why is because it will save the insurance companies money.
Sure.
So at the end of the day, it will be, whether, ounce for ounce there's any cost difference, the savings is going to be on the benefit. It's going to be lack of side effects, lack of death, lack of complications. And if so many patients just with the opioids, for example, horrible stomach problems, constipation that need to see, have procedures and treatments and things like that.
Sure.
And so you will eliminate that. I think you'll end up saving, in general, any, pain, anxiety, which are two common things that I use cannabis for, have a lot of downstream healthcare costs. People with anxiety and pain have other things that go wrong, and that leads to cost. And so I think when you prove to the government, when you prove to the insurance companies that they're actually going to save money by reimbursing this, then I'll think that you'll see it's covered. What I don't see is I don't ever see that you'll be able to go to CVS and get marijuana. I think because the dispensaries have moved in, because a lot of companies have put a lot of money into this, I do think it'll be a separately regulated process. Similar to like vitamins, for example. Like vitamins, you don't have to get a prescription for, you can get it at CVS, but you could also get, a GNC or get online or whatever. I do see I see now that the dispensaries are popping all over here, they're spread around the country. I see that mechanism maybe being a little bit more regulated, but I don't see the dispensaries going away and that you go into the pharmacy to get cannabis. I could be wrong about that, but I do see that it will continue to remain sort of parallel to what we have now, but hopefully one day it'll be covered by insurance.
Yeah, that infrastructure is being built and it's growing, and so I don't see it changing either.
Right, it would cost too much money, take too much time to sort of change that back. I don't think you put that genie back in that bottle yet.
Sure.
But I think hopefully with the legislation passes, the medical community, gets on board with that, and then hopefully insurance covers it. But this is something that's going to continue. I mean, again, it's not a panacea. It doesn't work for everyone, for everything. It's not completely without side effects. That being said, it's natural. It has very few side effects. It can be effective in a variety of treatments. So it's definitely something that should be considered, along with other things, along with prescriptions, along with physical therapy, along with manipulation, all those things to help patients with chronic pain.
Sure, and so it's really important for the audience who's watching and understanding that there are these evidence-based alternatives to managing chronic pain. Chiropractic, physical therapy, massage, acupuncture, yoga, these are all evidence-based treatments and interventions that can help patients in chronic pain, and it's great to know that we have another alternative as well with cannabis. So thanks so much for being with us today. It's great to see you, Matthew.
Great to see you.
And we'll see you soon.
All right.
Thanks, everybody.